The debate over celebrity use of Ozempic has exploded into the spotlight, and tonight we are looking at the controversy that erupted after Megyn Kelly publicly called out a group of high-profile figures she claims should be banned from using the drug in 2026, with Meghan Markle's name unexpectedly pulled into the discussion. What began as a conversation about diabetes medication and Hollywood weight loss trends has now turned into a wider cultural argument about privilege, access, and accountability, and the fallout is growing by the hour. Before we continue, please hit the like button, subscribe to the channel, and turn on the notification bell for updates. According to the article at the center of this story, Megyn Kelly used her platform to question how a prescription drug originally developed to treat type 2 diabetes became a fashionable shortcut for rapid weight loss among celebrities. Kelly argued that the surge in off-label use has contributed to shortages, driving up prices and limiting access for patients who genuinely rely on the medication for medical reasons. Her comments struck a nerve because they echoed frustrations already voiced by doctors, pharmacists, and everyday patients who say they are being pushed aside while wealthy public figures continue to benefit. Kelly's remarks were framed not as a medical directive but as a moral challenge. She suggested that celebrities who promote extreme thinness while quietly relying on drugs like Ozempic send a damaging message to the public, especially young audiences. In her view, this behavior glamorizes medically unnecessary use and creates pressure that ripples through social media, fashion, and entertainment. She went further by proposing that in 2026 there should be stricter ethical guidelines, or even bans, on non-essential use by influential figures. What turned this commentary into a headline-grabbing controversy was the inclusion of Meghan Markle in the broader discussion. The article claims Kelly referenced Markle while talking about celebrities who, according to online speculation and tabloid narratives, may have benefited from dramatic weight changes. It is important to note that no medical records were presented, and no confirmation was offered that Markle has ever used Ozempic. The mention alone, however, was enough to ignite intense debate and renewed scrutiny. Supporters of Meghan Markle were quick to push back, arguing that dragging her into the Ozempic conversation was unfair and speculative. They pointed out that Markle has long been the subject of body shaming and invasive commentary, particularly since joining the royal family. To them, Kelly's remarks reinforced a pattern in which Markle's appearance becomes a proxy battlefield for larger cultural arguments, often without evidence or consent. On the other side, Kelly's defenders said the point was not to single out Markle personally but to highlight how celebrity culture as a whole influences public behavior. They argue that whether it is Markle or any other public figure, the issue remains the same: powerful individuals shaping trends that have real-world consequences for healthcare access. In this framing, the controversy is less about one name and more about systemic imbalance. Medical experts cited in the article attempted to redirect the focus back to facts. Ozempic, they explained, is a legitimate and effective treatment for diabetes and certain weight-related conditions when prescribed appropriately. Problems arise when demand driven by cosmetic use overwhelms supply, leaving patients scrambling. Doctors emphasized that blaming individual celebrities may oversimplify a complex supply chain and regulatory problem, but they also acknowledged that celebrity influence plays a measurable role in demand spikes. The article also highlighted how social media has amplified the issue. Before and after photos, unverified claims, and influencer endorsements have blurred the line between medical treatment and lifestyle choice. Kelly's argument taps into a growing backlash against what critics see as a wellness culture built on shortcuts rather than sustainable health practices. In that sense, the call for bans or restrictions becomes symbolic, a way to reclaim seriousness around prescription medicine. Meghan Markle's involvement in the narrative underscores how quickly health debates can become personal. Her name alone guarantees global attention, and that attention often comes with polarized reactions. Some viewers interpret any mention of her as proof of targeting, while others see it as unavoidable given her status. The article suggests that this dynamic is precisely why celebrities wield such power in shaping trends, intentionally or not. There is also a legal and ethical dimension to the discussion. Banning specific individuals from accessing a prescription medication raises questions about fairness, privacy, and medical autonomy. Even Kelly acknowledged that enforcement would be nearly impossible under current laws. Instead, her proposal appears aimed at sparking conversation rather than outlining a concrete policy plan. As the debate continued, commentators expanded the lens to include other celebrities rumored to have used Ozempic. Names circulated across social media, often without evidence, fueling a cycle of speculation. This, critics warn, risks turning a legitimate healthcare discussion into a gossip-driven witch hunt. The article notes that such speculation can discourage people from seeking medical help out of fear of judgment. At the same time, patients living with diabetes shared personal stories of frustration and fear. Some described visiting multiple pharmacies only to be told Ozempic was unavailable. For them, the controversy is not abstract. It is about daily health management, blood sugar control, and peace of mind. Kelly's comments resonated with these patients because they voiced a sense of injustice many have felt quietly for months. The conversation also touched on responsibility within the pharmaceutical industry. Should manufacturers scale production more aggressively? Should regulators tighten guidelines on off-label promotion? While celebrities are the visible face of the issue, the article suggests the root causes extend far deeper into policy and profit structures. As for Meghan Markle, her representatives have not issued any statement in response to the claims referenced in the article. The silence leaves space for speculation but also reflects a common strategy of not amplifying unproven narratives. Whether her name will continue to be linked to the Ozempic debate remains to be seen, but the episode once again highlights how easily public figures can be pulled into controversies beyond their control. Ultimately, this story sits at the intersection of health, celebrity, and media influence. Megyn Kelly's comments have forced a conversation many were already having in private, even if her delivery and choice of examples remain divisive. The question now is whether this moment will lead to meaningful change or simply fade into the next cycle of outrage. As viewers, we are left to consider our own role in this ecosystem. Do we consume and share speculation without questioning sources? Do we hold celebrities to standards we would never accept for ourselves? And how do we balance free discussion with fairness and compassion? If you found this report insightful, take a moment to reflect on how celebrity culture shapes health trends and why responsible conversation matters. Share this video, leave your thoughts in the comments, and subscribe.